Good afternoon. Welcome to our COVID-19 information session with Dr. Cara Christ. As a reminder, this session is on the record. I am setting everyone up to record in Zoom. It may take a minute to get some of the stragglers here, but ping me in a minute if you're not set up to record. After Dr. Christ's presentation, we will be taking questions, and please raise your hand in Zoom to ask a question. And with that, I'll turn it over to Dr. Christ.
Good afternoon, everyone, and thank you for joining me today. We're a little bit later than we normally do, so I hope everyone has had a great Friday afternoon. I'm going to follow the similar format that we have in the past. I'll provide a brief presentation. It's got a little bit of a different flow of information this week, but I'll definitely leave time at the end for any questions like usual. So I'm going to start with spending some time discussing the current COVID-19 data in Arizona, and I'm going to talk a little bit about how public health interprets this data. So you've seen our epidemiologic curve. This is where we plot cases on the day that we get that their samples are collected so that we can follow the trajectory of the pandemic. You can see that we've overlaid important mitigation strategies or events on top to see how they impact our pandemic and the number of cases that we have had. This is another look at the cases in Arizona over time. You can clearly see the two peaks in case counts, one in the summer of 2020 and the other in the winter of 2021. What you'll also notice here is an increase in the number of cases per week in Arizona in recent weeks. About 90% of these new cases this month are in those who are unvaccinated. Case numbers are one important component of disease surveillance for public health, but the severity of the disease, how sick it makes people, is another important metric that we monitor. For that, we use hospitalization data, which I'll share in a few slides. By now, hopefully all of you are familiar with our percent positivity chart. This one is a little different than the one that's on our website. It shows the total number of tests and how many are in unique individuals and how many are in or repeat tests in individuals that have already had a previous test. This is important as we tend to get into the part of the pandemic where we are. We use percent positivity, which shows the number or the percent of tests that are positive out of the total number of tests conducted. And we use this as a measure of community spread of a disease. However, we interpret this data very carefully because you have to have a context of the testing as you're going through. So a lot of you will remember during 2020 and in the early part of 2021, many Arizonans were going to get tested, not just because they felt sick, but also for routine monitoring purposes. Now that vaccines are widely available and more than half of Arizonans have chosen to be vaccinated, we expect that those who have been vaccinated will be less likely to continue with routine surveillance testing that they might have been participating in prior to becoming vaccinated. In addition, we have other forms of testing coming onto the market, including over-the-counter testing. These testing numbers are not necessarily reflected in the numbers that we have in the total number of tests performed in Arizona. So that's going to change how much testing there is in the community. We expect that moving forward, the people who are symptomatic are going to be tested in greater proportion to those that are asymptomatic, which can increase the percent positivity because you'll have more people with symptoms who are going to have a positive result. Regardless, though, we know by the case numbers that COVID-19 cases are increasing in Arizona, which is why it's so important to get vaccinated if you haven't already been vaccinated. We continue to monitor hospital data through a variety of different sources. So this graph shows the number of inpatient beds in Arizona and the total number being utilized, and then those being utilized by COVID patients. So if you look, the light gray at the very top are available beds. The dark gray are beds that are in use by non-COVID patients, and the red is the number of beds used by COVID patients. You can see that at the peak of our winter surge, COVID-19 patients accounted for approximately 50 to 60% of all of the hospital beds in use, or actually of all of the beds that were available. As vaccinations proceeded, you can see that we saw a dramatic drop in the number and percent of beds that were being utilized by COVID-19 patients. And over the last few months, we've ranged to about 6 to 8% of the beds being utilized by COVID patients. The total number of beds in use has remained relatively stable throughout. Currently, we are starting to see an increase in the percent and number of inpatient beds being used, with about 9 to 10% of the beds being used by COVID-19 patients. And we are seeing a similar trend in our intensive care unit, or our ICU beds. When you take a look, you can see that at the peak of our winter surge, the COVID-19 patients accounted for about 50 to 65% of all ICU beds. And again, we see that dramatic drop when vaccinations started to become common. You can see that over the last few months, COVID positive patients utilized about 8 to 9% of the overall capacity, and all beds, again, remained at approximately a relatively stable capacity. You can see that we are seeing an increase over the last week or so in our ICU beds being utilized by COVID patients, currently accounting for about 10 to 14% of the ICU beds. The department uses syndromic surveillance to assess hospital usage and how much of the capacity at a hospital is being utilized for syndromes that are very similar to COVID-like illness. This was determined to be a very sensitive predictor for increases and decreases in hospital usage. You can see that over the past couple of months, hospital usage has been relatively stable per syndromic surveillance, but we are seeing a slight uptick in the percent of hospitalizations that are due to COVID-like illness. So one of the things that has become good data to have is our whole genome sequencing. And so this is how we determine the sequence of the viruses and what type of variants there are circulating in Arizona. You can see this is the percentage of specimens that have been identified as the Delta lineage over the past several months. You can see that that is increasing. One thing that we should clarify is not every single positive specimen is sequenced. We sequence approximately 12% of all of the specimens over the last 3 months. They're sent for sequencing to partners. This is not a clinical diagnostic lab, so it's not reportable back to physicians and patients in Arizona. This is a public health surveillance that we partner with TGen, our universities. The state lab does some of that sequencing to get a good idea of what variants are circulating in the community so that we can make recommendations on the population level. We partner very closely with TGen, and you can see from their dashboard that we've seen an increase in Delta from about 3% of the sequences being Delta in May to about 74%. So this is that light blue bar in the bars on the left-hand side, but it's the right 3 bars. You can see that that light blue, the B.1, 0.617.2 bar, that is our Delta variant, and you can see that that has increased significantly in the past 2 months. So we are seeing in the last several months that the main driver for the increase in COVID-19 cases is largely individuals who are not fully vaccinated. So the red line is cases in those that are not fully vaccinated, and you can see that the gray line is those that are fully vaccinated. That percentage has been decreasing as you look over the past couple of months as more fully vaccinated are. However, even in July, 90% of the cases have been in people who were not fully vaccinated. When you look at the deaths since March, approximately 98% of the deaths have been in individuals that are not fully vaccinated. And when we look at our hospitalizations that are not fully vaccinated since March, it accounts for about 94% of the hospitalizations are in individuals who are not fully vaccinated in Arizona. And again, this just shows the number of, or the percent of cases that are fully vaccinated versus the percent of cases that are not fully vaccinated. And the majority of individuals who are coming down with COVID-19 in the past few months are not fully vaccinated. I'm going to go through a couple of COVID-19 vaccine updates. So to date, 6.7 million doses of COVID-19 vaccine have been administered to 3.6 million unique individuals. We've got 3.3 million who are fully vaccinated. Over 51% of Arizona's total population has received at least one dose of vaccine, and 46% of the population has been fully vaccinated. When you look at the percentage of individuals who are eligible to be vaccinated in Arizona, so that is any individual who is 12 years old or older, 57% of the eligible Arizonans have been received at least one dose. And vaccine coverage among our most vulnerable populations, so our 65 and older, is high in Arizona. Nearly 90% of those individuals have received at least one dose of vaccine. And this is important because when you look at the deaths since the beginning of the pandemic, over 90% of the total deaths in Arizona have been in those that are 55 years of age and older. And as you look, almost 90% of our 65 and older are vaccinated with at least one dose, and about 70% of our 55 to 64-year-olds have at least one dose. As of this week, nearly 32% of 12 to 17-year-olds have been vaccinated with at least one dose of vaccine. And as we head back to school, we urge all of those who are eligible, including students 12 and older, to get vaccinated. If you are still looking to find a vaccine site, we have over 1,600 provider sites that have received vaccine supplies, including 300 locations that are currently offering Pfizer. And that's important because Pfizer is the vaccine that is available for those 12 and older. We also currently have over 1,000 retail pharmacies that are offering neighborhood vaccinations. And so you can find them at almost all pharmacies statewide to get vaccinated. On the right, you'll see our ADHS Find Vaccine app. It's been updated with a feature to search by vaccine type so that families who are interested in finding Pfizer for those that are between 12 and 17 years old can easily do that. This Saturday, we'll be partnering with the One Community Initiative on a vaccination and backpack drive. It includes a backpack drive with backpacks and school supplies available for families who receive a vaccination at South Mountain Community College. You also see that we have a Sunday event in partnership with the Diocese of Phoenix, and the team has pulled together additional educational resources for faith-based leaders who are interested and greatly supportive of vaccine safety and encouraging their congregations to get vaccinated. And we've been partnering with the Equality Health Foundation, which is one of 13 providers that can operate under state contract to provide pop-up clinics. And so you'll find a number of community-based vaccination sites in partnership with them. We've got a couple of reminders to our stakeholders. We do have provider communications available. So we, in working with stakeholders, we've identified that one of the most trusted sources for patients is hearing from healthcare providers, their personal doctors or healthcare providers. We have developed tools in both English and Spanish that can support our Arizona healthcare providers in communicating with patients about COVID-19 vaccines. So this includes frequently asked questions, how to address misinformation about vaccine, giving information to your patient about what to expect after getting a vaccine or at their vaccine appointment. These can be found on our website. We do have the links in the document, but they are on our website at azhealth.gov. We've also developed educational materials for youth and families. We know that parents have a lot of questions about getting their young ones vaccinated. There are toolkits and messaging if you are interested in working with doing outreach or working with populations that may serve youth and their families. And again, that can be found on our website at azhealth.gov. So just as a reminder of the key points, and then I'll turn it over for questions. 98% of COVID-19 deaths since March have been in those that are not fully vaccinated, and 94% of the hospitalizations are in those that are not fully vaccinated. Vaccine is highly effective in preventing these bad outcomes. We want every Arizonan who is eligible to get vaccinated so that we can avoid hospitalizations and deaths due to COVID. And for anybody that's looking to find a safe, free, and effective vaccine near them, you can go to azhealth.gov/find-vaccine. Thanks.
Okay, Director. Our first question is from Howard Fisher, if I can figure this out. Yes.
There we go. Well, I've missed us the last couple of weeks. It's been awful. So I have three basic questions. In May, about 95% of folks were who got the COVID were unvaccinated. It dropped to 92 in June and like 90% this month. What's going on there? Are there just more breakthrough cases, or is the vaccine less effective against COVID, or what's happening there?
So I think it's a combination of things, Howie, and that's a great question. So if you think we know that no vaccine is 100%, right? Nothing is perfect. So we do know that people who have been vaccinated can come down with COVID-19. However, their outcomes are going to be less severe. There's less of a chance that they'll be hospitalized or die due to COVID-19. What we are also seeing, though, we're seeing an increase in the number of vaccinated individuals. So that makes our pool a little bit higher for people who could potentially get COVID as a breakthrough case. But we're also seeing higher community transmission. So that's more opportunities for somebody to come into contact with COVID-19. And so we think it's a combination of a number of things that are bringing that percentage down.
Okay, second question. You mentioned that of the people who are eligible, when you take out the 12 and under, we are at like 57%. At the risk of putting a value judgment on it, that sucks. What are we doing wrong here? Why are we getting more people vaccinated? We seem to be among the lower tier of states. We ain't Missouri, but we sure aren't one of the more populated states. What are we doing wrong?
So I think that there's a lot of misinformation out there about the vaccines, and we've been working on a couple of initiatives here. We'll be issuing a number of social media short films addressing directly some of the misinformation that's out there about the vaccines and clearing that up. There's also a lot of fear about the vaccines. And so, really trying to get people who are trusted communicators in the community, healthcare providers, community leaders, to talk about their experience with the vaccine, answer any questions, encourage those individuals to get vaccinated. I think once it becomes fully approved, that may make some of those that are hesitant to get vaccine when it becomes fully approved by the FDA. We hear that a lot, that's one of the things that people are waiting for before getting vaccinated as well.
Okay. Finally, you mentioned the higher community transmission rate when you were answering the earlier question. At what point do you recommend to the governor, or do you say we really need to go back and look at some of the mitigation strategies we were doing, whether it's masks, whether it's occupancy limits, or something else? I mean, the numbers are going up. I realize they're not what they were in January, but at what point do you decide, given the increased community transmission, that, well, maybe those mitigation strategies make sense and we ought to put them back?
And that's a really great question, Howie. I think when you look, we're at a different place than we are in January, just like you pointed out. We do have the vaccine that's going to provide a level of protection. Our public health recommendations have not changed. So if you are unvaccinated, we recommend that you wear a mask whenever you are with people that you don't live with. Taking that time to assess your risk. If you are high risk for an outcome, whether you're vaccinated or not, is this an event that you should go to? Are there lots of people? Is it indoors? Do you know their vaccination status? And if not, you should wear a mask whether you're vaccinated or unvaccinated. So really taking a look at that risk. I think with the availability of vaccination and how effective it is at preventing hospitalizations and deaths, we might see an increase in hospitalizations and deaths, but we're not anticipating the same levels that we saw back in the winter. We continue to monitor, but we didn't put additional mitigation strategies back in the winter. So I would imagine that our recommendation is go get vaccinated and be fully vaccinated as quickly as possible.
Okay, well, I appreciate your optimism there, but we're gonna have to talk every week or two and see where those numbers go. Thank you.
Thanks, Howie. I appreciate it.
Peter Seymour. Hang on, Peter.
Hi, Peter.
There we go.
Sorry, I have
One
a
more
frog
time.
in my throat.
Peter, I'm having some problems. There you go.
There we go. Can you hear me okay?
Yes.
Very good. Good afternoon. So any updates you're hearing from pharmaceutical companies or federal officials or anyone else as to when all kids can get the vaccines? I know it's 12 and under, that can't touch them yet, restrictions, so on and so forth.
So we haven't heard a newly updated date. Initially, they had told us that it might be approved around September 2nd. Now we're hearing late fall, maybe early winter. But we continue to work with those partners. I am very eager for 12 and under to get vaccinated because I have 2 that are in that age category. So as soon as we find out, we'll let everybody know because we want to get as many people vaccinated as quickly as possible.
Would that be for all brands?
I've heard the Pfizer was the September 2nd. I think the general late fall, early winter is the Moderna and Pfizer.
Gotcha. And then you've shown us numbers that the younger people and younger adults and even closer to middle-aged adults are the ones getting the sickest. Why are they avoiding the vaccine? Is it because they think they're invincible? What are you seeing and hearing anecdotally?
I think it's a combination of both, or a number of things when you look at it. So I think, yes, they're looking at the outcomes. They're looking at, that younger age group tends to be asymptomatic or not have quite as severe outcomes. And so they don't feel that they need to get vaccinated. There's also all the misinformation. We get a lot of the questions about, will it affect my ability to have a baby? That would be an age group that might impact. It does not impact your ability to have a baby, just to clarify that. But what we need that group to understand is, yes, we are seeing more severe outcomes, and COVID is predictably unpredictable. And you might be the 99% that it turns out okay, and you don't have long hauler symptoms, but you might be one of the 1% that it doesn't turn out okay, and you don't know which group you're in until you get COVID. I have friends of mine that have gotten COVID and have been very, very sick, and these are healthy young individuals. So we would recommend everyone get vaccinated because we don't know how it's going to impact you, but you also don't know how it's going to impact others who may get it. And those individuals may be loved ones who are at high risk, like older relatives, grandparents, grandfathers. So you want to make sure that not only are you protecting yourself with the vaccine, but you're protecting others with it as well.
KTAR interviewed somebody yesterday, a widower actually, who, you might have heard the story. Do you think the horror stories are starting to get to people to, get their vaccines?
So yeah, that story brought a tear to my eye. It's unfortunate that, that we lose people to COVID, especially when there is a highly effective vaccine. And I'm heartbroken for him, but I'm proud of him for making that decision to go get vaccinated based on his personal experience, and then speaking out to encourage others, because I can't even imagine that loss.
It was tough. Very, very difficult to hear for sure. Thank you for your time.
Yeah.
I accidentally lowered the hand of a 15 representative, Danelle Gallardo. Sorry about that.
Actually, it's Mark Phillips.
Oh, surprise.
Hi.
Hi, Doc. How are you? I have two questions I want to ask you. And I want to make sure, since I don't follow this as closely as my colleagues here. But as I understand it, the breakthrough rate has jumped from June to July from 5 to 10%. So when people who you are targeting, who are folks that for one reason or other don't want the vaccine, they don't believe in it, or they are afraid of it, whatever, how hard is it now in your sales pitch to them when they hear the fact that, well, 1 in 10 people who have been vaccinated can get infected? How difficult does that make the sales pitch? That's my first question.
That's a great question. And it does make the sales pitch hard. I think one of the important things that people should realize is no vaccine is 100%, but the vaccine has a really high efficacy in preventing hospitalizations and deaths. So even if you're counted as a potential COVID case, your case is going to be less severe, less likely to put you in the hospital, and less likely for you to die from COVID-19, which is ultimately what we want to prevent everybody from experiencing. So what we would say is, based on increasing numbers of vaccinated people, so you are going to see higher numbers, increasing numbers or increasing community transmission, which is going to give the virus more shots at vaccinated individuals and more tries at infecting those individuals, that can increase. But the efficacy of the vaccine in preventing hospitalization and death is one of the main reasons you should get vaccinated.
Okay, now my follow-up question. The
Yeah.
state's mitigation strategy is, if I understand, get vaccinated. The governor's been pretty clear. There's not going to be a mask mandate, vaccine passports, that sort of thing. So my question is, if the state's why is the priority, if we're still in the midst of a pandemic, that we basically appease the very people who are not taking the health concerns serious enough? Why are we doing more for them than for other folks who basically want to be saved?
I think that there's a lot of steps that people can take, and our public health guidance and recommendations have not changed. They have remained constant. Vaccination is the most effective means we have of preventing transmission. What we would recommend, though, is unvaccinated individuals should wear a mask when they are out. That hasn't changed. We want people who are unvaccinated. We know Delta's out there. We know that it's more contagious. People should wear a mask when they are out. High-risk individuals who may be vaccinated but may have a high risk for a severe outcome, those individuals should consider wearing a mask when they're out as well, because we know we've got increased community transmission. And always, we always recommend hand washing, staying home when you're sick. But these are things that people have to take on their own. And so I don't know that we're accommodating one group or another. Everybody needs to take the steps that they feel comfortable in preventing COVID-19. But the best step that anybody can take is getting vaccinated.
Okay, thank you.
Thank you.
Christina Durant.
Hello.
Hi, Dr. Chris. Thank you. So my question is, we're going into a school year with rising cases, prevalence of a Delta variant, and schools unable to mandate masks. So I want to know the likelihood of a larger outbreak, and then the possibility of those outbreaks then affecting community transmission.
And that's a really good question. As we look at anytime we look at bringing large groups of individuals back together, especially indoors, we could see an increase in the number of cases. And that could go into the community. The best thing that parents can do is to get vaccinated if you have children under the age of 12. And our school guidance recommends that all unvaccinated individuals, which in this case includes children 12 or under 12, wear a mask when they're indoors at school. As a parent, I've got 3 kids, and I know a lot of you have heard this. My oldest is fully vaccinated, but I've got 2 that aren't eligible yet. And they went back to school on Wednesday, and mean mom, me, is making them wear masks at school. From what I can tell, it sounds like a lot of their friends are wearing masks as well. So kudos to the parents who are, making their children wear the masks. We also recommend making sure that you're doing those health screenings before sending your kids to school, so that if they've got symptoms, keep them home. So that they don't spread. Not only are we seeing COVID in the community, we're starting to see increased other respiratory viruses. So we just want to make sure we're not spreading anything at school. So make sure that you keep your kids home when they're sick.
And then just another question. I know how I mentioned maybe upping our mitigation strategies, but would there ever be a point where maybe even vaccinated individuals would have to go back to wearing a mask in certain situations or anything like that?
So, there could be changes to the recommendations based on the community transmission. We do recommend that even fully vaccinated individuals who may be at high risk, if you're going to a large indoor gathering with people you don't know or don't know their vaccination status, that you wear a mask, even if you're fully vaccinated, just because there's going to be a lot of people and you're going to be indoors. We continue to take a look at the data and may make a recommendation that if you're out in, large groups indoors, that everybody wear a mask, but that would remain a recommendation.
Thank you.
You're welcome.
Next is Jared.
Hi, Jared.
Hi, thank you for taking time to take questions from us.
Yeah.
My question is, the department's been doing outreach throughout, this vaccine process in certain zip codes. You talked also about how, you're doing some outreach in the South Mountain region, I believe is what you said earlier. I was looking at the zip code data, and it appears that there's a lot of kind of rural areas of the state that don't have, in some instances, any people who've gotten vaccines, but large numbers of cases. I was curious as to if there's any plan in the near future, especially with cases of COVID kind of starting to increase here, to try to reach out to these more rural communities to get vaccines and arms out in those areas as well.
Yes, that's a really great point. Our epidemiologists look at the zip code data. They look at some of those smaller communities and then work with our local health departments to let our local health departments know, hey, here's what we're seeing in the communities. What types of resources do you guys need in order to target? Because they're really the boots on the ground and they know those communities. They know what's going to work in those communities. And to offer the support that they may need, because the contract that I talked about that we have with the One Community Initiative, we have that with multiple providers, and those contracts are statewide so that we can send out vaccinators to those areas. In some of the rural areas, like one of them's the San Luis Somerton area, we did do the same intensive targeted outreach that we did in the South Phoenix area, trying to go door to door, talking to people, arranging for them to get vaccinated, answering questions, doing town halls and those types of things. We continue to look at the benefit of that versus working directly through the local health departments to engage those communities as well. But it is something that we're definitely working on.
And, is that something that, you said you're going to continue looking at that. Is that something that you're looking at or you're actively pursuing? I mean, when you look at the history of the state, those rural areas are in some of the more healthcare provider shortage areas, and during the first surge, some of those areas like Tuba City and stuff were hit pretty hard during those first surges. So is that something that the department is currently in talks with those rural areas as we're possibly looking at this current surge in cases?
Yeah, that's exactly it. So we have been working with our local public health departments and are actively engaged with them. So as we continue to look at the data and identify new areas, our EPIs may point out those updated areas, but it's something that we've been working on because just like you said, trying to get healthcare to some of those rural areas can be a challenge with healthcare shortage providers or provider shortages, a lack of access to potential like vaccine sites. So our contracts actually provide for mobile services and pop-up events so that those contractors can go anywhere where they are needed to provide vaccinations.
One last real quick question. With this, kind of change in cases, and we were looking at hospital data earlier. Is there any possible plan to, or any possible talks about changes to, I remember during the last surge in cases, we implemented some kind of, plans for the hospitals to prepare for these, extra cases. Is there any talk about implementing any of those plans, or any hospitals already looking at getting some of those plans in place to prepare?
So those plans have stayed in place. They are required to have a staffing plan. They're required a while ago to identify those additional surge beds in case they're needed. The Arizona Surge Line has been active and engaged the entire time. So all of those are actually still in place, and the hospitals still have the same types of strategies that they had during previous surges, whether they want to bring in traveling nurses or they want to look at how to reduce the number of non-COVID patients. If the COVID patients go up, they have all of those options available to them.
Thank you.
Welcome.
Next, we've got AZ Family.
Hi there, it's actually Brianna Whitney. Hi, Dr. Christ.
Hey,
thank you
how
so
are you?
much. Good, how are you?
I'm good.
I have two questions. One's COVID and one isn't. So I'm going to start with the COVID one. I know you've said in this press conference and when we were talking earlier this week, quite a bit about sending your kids to school with masks who are not eligible for the vaccine yet. But we did have the governor today tweeting more about his, anti-mask mandate for schools. Do you feel like the two of you are on different pages on this aspect moving forward for the school year in terms of kids wearing masks in certain situations?
I think the governor he follows the public health guidance. State law prohibits a mandate at the schools, but the recommendation that unvaccinated individuals should wear a mask when they're around that, I don't think we're on separate pages for that. And so it really is encouraging parents to understand that their kids are going to be mixing indoors with other individuals. And so it's really important to wear masks. We know a lot of parents believe in parental rights and want to have that decision-making authority left to them. And that's what this state law allows.
Thank you. And then just one other question. So I'm assuming you probably saw this yesterday, but a horrible death at the Canyon Winds Assisted Living Center in Mesa, where the 90-year-old man was left in a transport van for 20 hours and found dead. They are on AZ Care Check. It looks like they have a pretty squeaky clean kind of citation list, only a couple things, but at the same token, this is a completely heartbreaking situation. Is this something the state will be looking into, the state health department, and working directly with that facility in terms of any sort of consequences or ramifications or anything that comes from this?
Yeah, so this is a heartbreaking situation. And yes, we were notified and our team is on site today and has opened an investigation.
Is it considered a criminal investigation or just an investigation in general?
From our perspective, it would just be like the licensing investigation. I'm sure that local law enforcement is involved and they would be doing a criminal investigation, but I can have Steve Brown back with you on that.
Awesome. Okay, thank you so much. I appreciate it.
You're welcome.
Okay, Lorraine.
Hello.
Hi, good afternoon, Dr. Christ. Happy Friday. I wanted to piggyback off the question that Brianna had just asked, just in regards to you and the governor's office being on the same page. I know that a spokesperson for the governor's office did say last week that, the language and the legislation that has been passed earlier this year about what schools are able to do when it comes to mitigation efforts is specific to schools, and I think, quote, they said it's not the same as general public health guidelines. So I know, Superintendent Kathy Hoffman has herself said that she feels like schools are being unfairly singled out here when it comes to this public health guidance. I know you just kind of touched on this a little bit, but could you talk a little bit more about, the position of ADHS specifically and, kind of the messaging from the governor's office that, it is not the same thing or, and just kind of, that the guidance and mitigation measures for schools are not the same. I was just hoping you could expound a little bit more on that.
Yeah, absolutely. So I think there's been some confusion on, what was said was state law versus the public health guidance. And I think that's what the governor's office was trying to convey. All of us believe that the best place for our children is in school. School offers a lot of benefits, and public health strongly believes that kids should be in school, and that's what we're working towards. That new law that was passed at the end of June prohibits schools from utilizing vaccination status or the use of masks for providing in-person services. And so what schools can't do is make a blanket recommendation that all unvaccinated individuals need to quarantine. But that's not how public health works, and public health guidance has remained unchanged. So contact tracing with isolation and quarantine is still a tool that our public health departments can use in conjunction with schools. But they do that on a case-by-case basis. And so, when we identify a confirmed positive case in a school, they do that contact tracing, and we identify very close contacts. And that means they have had to spend a certain amount of time within a certain amount of distance to the case. And then public health will work with those individuals and their families to identify what is best for those individuals. And that's regardless of whether they are vaccinated or fully vaccinated. Now, what we can't do is say, oh, you're unvaccinated, you're definitely quarantined. But public health doesn't do that. They would take a look. There may be recommendations that a fully vaccinated individual quarantine. They might have high-risk individuals at home. They might be high risk, or we may just be looking at the community transmission in general and recommending that all close contacts be quarantined. So it's really a case-by-case basis, and it was just clarifying that law that you can't exclude children from in-person services based solely on their vaccination status or whether or not they use a mask.
I appreciate that. Thank you. And, jumping off of that point, you said that, quarantining is still a tool and that it should be case by case. I believe in your blog earlier this week, you said, it's a tool that should be used, I think, sparingly. But we know, I think, following the governor's office's letter to two Arizona school districts last week, that at least one district did decide to update their mitigation measures when it comes to quarantining, and specifically is going to make quarantining optional for students who aren't exhibiting symptoms. I'm curious, does the department's guidance on best practices when it comes to utilizing, quarantining in the event that, some school districts start to see increased spread of COVID-19 in their school communities? I believe we're starting to see some of that in some school districts in Maricopa County. So yeah, I'm curious if and when the department might kind of update that guidance or if that messaging will change depending on how the community spread starts to look in school districts as the school year gets going.
So our guidance is a network of layered prevention strategies that range from vaccination to consistent use of masks, quarantine or isolation in conjunction with contact tracing, increasing the environmental the environment, so increasing the ventilation, and then ensuring that you've got adequate hand washing and hygiene and keeping kids home when they're sick. So it's a number of different strategies, and those are in alignment with the Centers for Disease Control and Prevention guidance for K through 12. I don't see us updating that unless the Centers for Disease Control and Prevention update their guidance. The recommendation clearly, when you look at CDC and when you look at our guidance, everyone feels that the best place for our students is in schools. So even if a school is unable to implement all of the mitigation strategies, that's not a reason to not have in-person learning. We would encourage, working in public health for a long time, rarely do we get to mandate things. A lot of the mitigation strategies for a number of communicable disease, and I can use influenza as an example. Influenza can be very serious. It can kill children. But a lot of times we'll work on a voluntary basis. Influenza vaccine is not mandated for children. It does spread rapidly if it potentially gets into a school. And if we identify cases, we may ask certain individuals to stay home. But a lot of times that's working and getting voluntary compliance with the families and with others. And so, rarely do we quarantine for influenza. It could happen potentially if you had an outbreak. But we use those same principles on a number of communicable diseases, and we really do try to work with the families. I mean, we have legal orders that we can go to court and order somebody, and it has been very rare the number of times that we have ever had to do that. Most of the time, we can get people to comply with recommendations.
I appreciate it. Thank you.
You're welcome.
Bram Resnick.
Hi, Bram. I can't hear you. Oh, that's Steve.
Sorry.
I apologize for Steve.
There we go. Sorry.
There you are.
Yeah. Now you know how people at our morning Zoom meetings feel about me. And yeah, I have a 7-second delay. So granted, it is not February, but 2 public health experts this week, 2 experts who have been correct throughout this pandemic, project exponential growth in the virus. So the question is, why wait for that to happen? Why not take measures now, more aggressive measures than you've already proposed or are following?
So our recommendation really is that as many people get vaccinated as possible. We continue to monitor the cases and look at what the severity of those cases are. And we'll make recommendation. However, there are new state laws that change some of the mitigation strategies that we have available. When you look back at February and January and December, when we had some relatively high cases, our recommendation was for those that were eligible, which was a very small number of people when you look at December and January, to get vaccinated. But really, making sure that people understand the risk, what the measures they can take are to prevent getting COVID-19, and then to make sure that they have access to the vaccine when they choose to get it.
Well, talk about what the legislature and governor have done, because they have taken a lot of mitigation strategies off the table. The governor today told us what he wouldn't do. Are there any strategies you want back, you think we need to follow, that should not be illegal?
Not as mandates. I think in public health, we work with a lot of recommendations that can keep people healthy. People determine what their acceptable level of risk are. I joke because I'll never be caught in a car without a seatbelt. It makes me feel uncomfortable, but I'm going to be the one that eats the raw cookie dough out of the bowl. That's an acceptable risk to me. I got vaccinated as soon as I was eligible because that was not an acceptable risk. And I make my children wear masks because they're unvaccinated. So I think, we continue to keep our public health guidance the same. Rarely do we have the authority, except in public health emergencies and stuff, to potentially issue mandates. So I would just encourage everybody to follow the public health guidance. It works. We know that it works, and get vaccinated as soon as possible.
So you're comfortable with all these new laws that were enacted to limit mitigation strategies? Yes or no?
It doesn't inhibit our ability to make recommendation and guidance, which is normally what we do in public health. And so, I would say that would be a great question for the legislature and its members.
But the question for you, does it limit your ability? Has what the legislature and governor done limit your ability to fight this pandemic?
I think we're in such a different point. I don't know that we need those mandates. You watch what happens in other states, and a lot of the states are experiencing the same thing that we are, whether they have mask mandates or not. And so, I think we did have local mandates here. The people that were going to wear masks wore masks, and the people that weren't didn't wear masks. And so, you have to have the ability to be able to enforce that, which we did in our jurisdiction. But it wasn't necessarily enforced. So I don't really know how much those mandates really helped, because it really was left to the people that were going to do it, were going to do it.
Last question, if I can, and sort of thinking outside the box. Much of what we've heard about the solutions here is get a shot. That's been a recommendation for a while. It's not working with a lot of people. In an interesting conversation yesterday with two public health experts, they say one of the biggest obstacles is people don't want to take time off work, unpaid time off, to go get a shot, or to be sick, because some people get sick after a shot, or to care for a child, after they get a shot. Mm-hmm. What can the governor's office do to work with business to help make that paid time off happen?
And that's a great question. I think, we've been encouraging employers to provide time off after people get a shot, because you are exactly right. People can have side effects, and they can feel like they've got the flu or flu-like symptoms for a day or two after they get the vaccine, and having to take care of children. If they get a fever and can't go to school or childcare, can be an issue. And so that is an issue that we've brought up. Working to get paid time off that's a challenge. And so trying to partner with some of those individuals to encourage that is something that we'll continue to work on.
Do you blame people who aren't getting shots for this new spike?
I don't place blame. I think that there's a lot of hesitancy out there. I think that there's a lot of misinformation that scares people about getting the shot. I hate to see the numbers increasing when there is a tool out there that would prevent people from having to get sick and having to suffer through this. And that's something that we're going to continue to work on. I don't know that it's blame, because really it's hurting the individuals that get COVID-19. And I just want everyone to avoid getting it.
Thanks very much. Enjoy your weekend.
Thanks, Bram. You too.
Juan Juarez.
Hello.
Hi, Doctor. Nice to see you again. It's been a while for me.
How are you?
Great, thank you. So I wanted to ask you a couple of things, and one just came to my mind before the other questions that I wanted to do. But right now, I was looking at your page. It's got about 1,400 cases reported today. So from all the large increments that we've seen, how severe, if you have any data or information, how severe have the sickness been for people getting infected, since it's been primarily the Delta variant that they're catching? How sick are people? Because obviously we knew from the past, some people had mild symptoms. So how much is it affecting the people that are getting sick right now?
So I think we're seeing the same broad range of impacts from COVID-19 with Delta. You do have people that are asymptomatic, especially those that may have already received the vaccine. And we have people that are getting hospitalized and dying. Anecdotally, I've heard from our healthcare partners that people seem to be getting sicker faster. And I don't have a lot of great data on that. The data that I have, shows that we're starting to see a slight increase in hospitalization usage, which indicates that, that based compared to a couple of weeks ago, we are having people with more severe disease. But it'll still be a couple of weeks before we have a good handle on how much of that there is, because hospitals tend to lag about 2 weeks behind the cases and then deaths a couple of weeks after that. But we continue to monitor. I think, one of the really good things is that we prioritize our vulnerable individuals very early on. So those over the age of 65, those living in congregate settings, our first responders, healthcare workers, and law enforcement and teachers. We had really good uptake at the beginning, and like I showed, almost 90% of those over 65 and above, which account for the majority of the deaths and have accounted for the majority of the hospitalizations. That's going to decrease the outcome in those individuals. So we're carefully watching to see how this if it continues to be an increase, what that looks like for severity.
But you're saying people are getting sicker faster, and it is seen that it is affecting them more than before?
That's anecdotal, what I've heard from the healthcare partners. We don't have any data to show that. All I have is the hospitalization data, which right now is showing a slight increase in usage, but nothing compared to the winter that we saw. So it's a little early right now to talk about the severity that we're seeing.
Okay, so now the question that I had originally was obviously the governor put out the statement today urging people to get vaccinated with the Delta variant increase of cases. However, at the end, he pretty much says that he's not going to be doing any lockdowns. He's not going to do any mask mandates. So if the situation continues like we see it, and if you are truly worried about the increase in the cases, what's going to happen next if we don't see a change?
So our main message is we've got a highly effective vaccine that prevents hospitalizations and deaths. And we are encouraging every Arizonan to be fully vaccinated. And the key is fully vaccinated, because we know one dose with when you're dealing with the Delta variant does not provide as great protection as 2 doses do. So we would recommend, as many people as possible get vaccinated, because that's the best prevention tool we have.
So if the vaccination, we've seen a slowdown, but if the vaccination doesn't increase more than what it is now, do you have anything that you plan to do?
Our guidance remains the same. We recommend that unvaccinated individuals wear a mask. We recommend that, you stay home when you're sick, you don't go to large crowds, especially indoor crowds with people that you don't know their vaccination status. And we'll continue to maintain that guidance as long as we have COVID circulating in our community.
All righty, thank you.
Thank you.
We have a couple more minutes, and Howie is back with a bonus question.
Hi, Howie.
Hit the right keys there. Real quick technical question. You mentioned about 57% of those eligible have been vaccinated, which leaves 43%. Of the 43%, what percentage of those are just one-dosers as opposed to people who just have decided, I'm not going to get vaccinated at all? Any thoughts on that?
I'd have to take a look and see. We do know the number of I don't have that number off the top of my head, but we can get you how many were fully vaccinated versus just have 1 dose versus have 0 doses.
Yeah, I mean, I'm looking at 43%. That's a big chunk. And if a lot of them are people who've just said, I'm not going to get it, that's it gets back to the questions that everybody was asking about, this sort of insurmountable hurdle here. So fair enough. I will anxiously await a call from Steve.
Perfect.
Looking forward to it, Howie. Peter Seymour, bonus question.
Hi, Peter.
Thanks for this bonus. I promise this will be quick. So if someone has a breakthrough case, do you recommend them getting another vaccination 3 months later, perhaps?
No, so we don't recommend right now getting a 3rd or a booster dose at this time. We continue to work with our federal partners and the drug manufacturers as they make recommendations, but ultimately that infection is going to serve as another boost in their own, because their immune system is going to respond. It's going to learn it better and should help protect them the next time.
Sounds good. Thank you.
Yeah, you're welcome.
More question from Johnny Cordova.
Okay.
Hard time unmuting today. There you go.
Hi, Dr. Christ. Dr.
Hi.
Thanks for taking my question. So going back to schools, is plan to work with any third parties to monitor like the health of students and teachers?
So there's a number of things that we're doing. Our local public health departments, so our county and tribal health departments, work very closely with their schools. On as cases are identified, we're also offering a testing solution if schools are interested in volunteering to do surveillance testing at the cost to the state. And that's something that they can do to do surveillance testing, because we know a lot of younger individuals have asymptomatic disease. And so, we've got a lot of tools and resources on our website at azhealth.gov. You can click on the schools box, and there's a lot of different things that schools can do to help monitor the health and safety of their staff and students.
Thank you. And if I may do a quick follow-up. The numbers started going up for the number of cases within the last, maybe now I think it's 13, 14 days. The only when we had less than 1,000 was on Sunday, when we had 980 cases. So is there a particular incident that pinpoint
I don't know that there's one specific incident or event that we're looking at as a potential cause for the increase. I think that, as we get Delta in the community, and it's been in our community for a little bit, it's much more contagious, can spread to more people more easily. And we think that the increase in cases is just that establishing itself as the predominant strain in Arizona. And so that's why we're seeing the increases.
There was talk of July 4th and also the Suns games. Would you say two events help maybe to spike the number of cases? And do you foresee that they're going to be now going down?
We'd have to take a look. It's hard to tell and pinpoint to some of those events. Definitely, whenever you get people together in large groups, especially indoors, you do increase the risk of transmission. And so that could be. And if it was due to events, then hopefully we would see a decrease. But given what we're seeing with the Delta variant, I would expect us to continue to see increases in cases for a while.
It's 4. Dr. Christ, thanks for your time, and we thank everyone for joining us today.
Thank you.